What you can do right now about the coronavirus. The coronavirus is now testing the global population in ways no microbe has for a century. Much is unknown about exactly how this particular virus causes the disease known as COVID-19, but much is known about how best to stop it. The basic principles of disease mitigation that have worked reliably for millennia, hygiene and social distancing, are no less applicable today. While the world waits for vaccines and medications, slowing the spread of the new virus is crucial. Using hand sanitizer? It works, if you can find it. Use it often. Make sure it's alcohol-based, at least 60% alcohol. There are some natural products that contain less, or none, designed to be less drying to your hands. These can't be counted on. You can also make your own with isopropyl alcohol, if you can find it. Washing hands? This is always important, but especially now. Wash your hands for 20 seconds, regularly. Note that soap works ideally in combination with scrubbing and heat, but cold water works far better than nothing. You do not need antibacterial soap. The coronavirus is a virus, not a bacterium. Shaking hands? It's not a clearly threatening practice, and physical touch has its own value to consider, as do gestures of respect. But I've been an advocate of alternative forms of greetings such as fist bumps for years, and this outbreak doesn't change that. Touching your face? The person most likely to give you this virus is you. It will happen when you touch something coated in viral particles, getting them onto your fingertips, and then touch your face. Avoiding touching your face would be very effective, but no one is going to stop, at least not entirely. That said, if everyone did even a little less face touching, it might make a dent collectively. Using bathrooms? Here's an unproven suggestion from me that transcends this particular outbreak. All business and public spaces should turn their bathrooms' doors around, so you push on the way out rather than the way in. If building codes or other safety codes prohibit this, install a foot pole. Or, as long as privacy is moderately protected, remove the door altogether. Disinfecting common surfaces? The crux of all the focus on hand washing is that you're unlikely to get the virus from someone coughing or sneezing directly into your face. You are much more likely to catch the virus by touching something that someone else touched after coughing into their hand. This can partly be prevented by disinfecting surfaces. Cleaning phones? This one warrants its own special note because phone screens may be the surface we touch the most. Other, similar coronaviruses are known to live on glass for up to 4 days. If you've been touching your phone with viral hands, then you do a beautiful job washing those hands, and then you touch your phone again, you may have just recontaminated yourself. Wearing masks seem logical as preventive measures because the disease is spread by respiratory droplets, which can travel simply by breathing but mostly distribute in plumes from coughs or sneezes. If you were sick and had to leave home for some reason, ideally you would wear a surgical mask. Stockpiling food? This mainly applies to people in remote areas where the town's one grocery store could close down. Closing the store would be preferable to having sick employees report to work. In these areas, it's always advisable to have a short-term supply of food for any natural disaster, and this would be fair to treat similarly. Stockpiling prescription medications? Most U.S. prescription medications are made in China, whose own outbreak has raised concerns about medication supply chains. As of now, supplies have not been disrupted, and China is reporting declines in the spread of the virus. As with food, though, anyone who has a vital prescription and lives in a place where access would be affected by the single shutdown of a local pharmacy or a public transit system, for example, should always have a small supply for emergencies. Healthcare providers should help ensure this. Traveling? It's always advisable to avoid travel if you're sick, and especially now. Until the world has a better handle on how far this virus has spread and what to do about it, travel of all sorts should ideally be kept to a minimum. But no stay-home directive is sustainable for long periods, and urgent life events will overlap with this outbreak. Staying home? This is an extremely imperfect directive, as so many people's jobs and other obligations make it impossible. But no single recommendation is perfect or universally applicable. And Americans have proved, flu season after flu season, that many workplaces are not accommodating enough of staying home. Seeking medical care? This may be the most crucial question: when do mild symptoms warrant attention? Most people are not accustomed to seeking care or testing when they have a mild cough or runny nose. My hope is that, in the coming days and weeks, local and federal officials share clear guidelines for exactly how and when to seek medical attention early in the disease's course.